All right, welcome everybody to Give Black, Give Back series. This week, we're so excited that you are here. I am Kia Jarmon with the co-chair of Give Black, Give Back, Lisa Swift-Young. Wave at the people, Lisa, so they can see who you are. Can you hear me, Lisa? Hey, okay. We're here to again come back and have these monthly or bi-monthly conversations, really to talk about what's pressing in our issue in our community. And Give Black, Give Back's mission is threefold. We serve as a resource and amplifier of the Black-led funds at the Community Foundation. We also support the efforts of nonprofits that are run by and serve the Black community. And we provide access and education to the community on how to build or sustain philanthropy to strengthen our economy. And you can find more information at blackgivingback.com. Let me pass it over to Lisa so she can tell you more about our conversation for today.
Perfect. I want to remind you that Give Black, Give Back is an opportunity to honor and celebrate the giving of Black individuals, foundations, and businesses in the Black community with financial contributions and their time. We are celebrating conversations centered around the past, the present, and the Black community and philanthropy. Before we get started, I want to invite you to like the Community Foundation of Middle Tennessee's Facebook page and to stay in touch with us. As Kia mentioned, we'll be doing these every other month. So you'll be able to get first information and invitations. And please right now, go ahead and share this in your timeline and like and send us comments and questions that you have. We also want to invite you to, as Kia mentioned, the GiveBlackGiveBack.com and list of funds and nonprofits supporting tornado relief right here in Nashville, Tennessee, as well as COVID-19 relief. So there's a lot of funds if you're interested in giving back. Today, we have 4 expert panelists and practitioners from Nashville. I want to welcome our guests and invite them as well. So I have Drs. Melville-Chester and Anidolee Melville-Chester of the Tree of Life Counseling. As well, they're affiliated with consulting services of Brentwood and Meharry Medical College through the Elam Medical Health Center. Also, we have Dr. Tammy Hines of the Bellevue Behavioral Health Group and Mr. Gregory Holley, who is the owner of Transformative Mental Health and Wellness LLC, and also a consultant at Behavioral Health Group. So first of all, thank you guys so much for agreeing to spend the time today and talk with us. I want to start us off with a few statistics if people are not aware of the impact of mental health in the Black community specifically. This was an article that came from the United States Health and Human Services, and just some facts. And our panelists will be able to levy their information on that. So Black and African Americans are 20% more likely to have a serious psychological distress than white Americans. We also attempt suicide at a higher rate as far as teenagers are concerned, so 8.3% versus white teenagers. Also likely, in 2015, the study was done, and it says among mental health, 48% of whites receive services, where only 31% of Blacks receive services. Microaggressions and mental health, which we all are aware of, higher frequencies of racial microaggressions and negative predicted mental health. Racial microaggressions are significantly correlated with depression. So microaggressions are associated with depressions in a short form. And there's significant disparities when we're talking about quality of care. So Black people are 7 times more likely to live in areas where mental health access is limited, whereas only 1/3 of Black people who need Black mental health services actually have access to that. So if you wondered why we're talking about that, other than your own personal, there are some statistics out there to show that this is a growing problem. Obviously, all these studies were done prior to 2020, so you can only imagine the impact. So these experts are going to discuss a little bit about what's happening right now, some ideas about self-care and how philanthropy you can get involved. So I want to welcome you guys to the panel, and I want to start off with Dr. Anidolee and ask her specifically, what is one thing you wish people knew about mental health in the Black community?
I think the one thing I wish is that people knew that it was okay to take care of your mental health. in the Black community. Just like we take care of our physical health, it's okay to take care of your mental health. That taking care of your mental health doesn't mean that you're broken. It doesn't mean that you don't trust God. It doesn't mean that something is seriously wrong with you. It just means that you're at a place in your life where you're not well, you're not experiencing wellness, and access and service give you an opportunity to achieve wellness. And that there are individuals like myself and Tammy and Gregory and Rob that are in the community that are sensitive to your needs, that are sensitive to where you are in your life, and we are willing to meet you where you are and help you to achieve wellness.
Perfect, perfect. Tammy, do you have anything to add to that? Your demographic is a little bit different. I know we were talking offline. So do you think that changes with age as far as what some things that you would want people to know about mental health?
So one of the important points that I want to make about mental health, everybody has physical health. Everybody does not have physical illness. Everybody has mental health. Everybody does not have mental illness, right? Despite not having a physical illness, we still go to the doctor for a yearly checkup, right? If I broke my arm today, am I going to sit on the couch and just not treat it? First thing I'm going to do is go to the emergency room and say, I think I broke my arm, and they're going to do what? Treat it. So I would like for to educate people to look at mental health the same way. We, in our communities, Black people tend to call it life. Oh, that's just life. No, that's just trauma. So that's what I have to offer.
Perfect. That's awesome. That's definitely one of those things. And I know right now there's a lot of things that, what's normal. So like, what is normal to feel in 2020? Greg, can you sort of elaborate on that? What should we be feeling that's normal, and what should we sort of be signals that's something we need to reach out for?
Yes. So I would first like to say that, given what's happened in 2020, feelings of uncertainty are very common. I would also like to say that given the events in 2020, we have all ingested some form of stress that we carry and deal with differently. And so when we look at how we react to it in different ways, some range of feelings and reactions that are common pretty much are just excessive worry, fear, anxiety, depression symptoms, and things like that. So when we think of what's normal, I would say that there isn't a normalcy in 2020 when we look at the different events, but it's okay to feel uncertain. But just being able to highlight and pay attention to the way that you feel, and reaching out to loved ones and professionals and gaining those resources, as we'll talk about today.
I want to add on to that, Lisa, especially in the Nashville community, okay? We survived a flood, okay? So we are very, very resilient people. We didn't survive that flood independently. Everybody was on a team. Everybody had a role. The tornado got overshadowed because of COVID. Then we have coming up, the quarantine. So all of those things, when we don't address them, they just build on top of each other. But we know that we live in a very resilient society, but Black people should not think that because they're resilient, that they don't need to address mental health issues.
I think that's a really good point to make. We have in Nashville specifically been impacted in a very unique way. And so there are some things that, I think, Greg had mentioned earlier that are, nothing's normal, but at the same time, what are some triggers that might be an issue? Dr. Rob, in particular, what are some common triggers people should look for in assessing their own mental health to know that maybe this is something I need to address that's beyond the common?
Well, if I'm stressed, I would like to start with some things that are simple. If I'm not sleeping well, if my diet is off, I'm either eating too much or I'm eating too little, or sometimes it's what I'm eating. If I'm eating all snack stuff and nothing really healthy, these are some simple things that are kind of like, okay, something's not quite right here. So I mean, we can always try to find some of the other things, but if I've been depressed and I've been sad and it's been a long time, that's something to be concerned about. If I'm nervous and jittery, and those are some things to kind of look at, okay, wait a minute. I'm not quite feeling what I normally feel. I'm not quite feeling comfortable like I normally feel. And so I'm a little bit off, and I need to kind of actually find someone that's going to kind of help me kind of get back to that norm that I had. It might not be something that I was at before, but finding a new norm for the experience that I'm having now, that's kind of what I'm looking for.
Can I jump in and add to that a little bit? Also,
Go ahead.
if you're just pessimistic all the time, if you're blue all the time, if you're feeling hopeless, lack of energy, you're just feeling fatigued, like, you know, I can't get anything right, nothing is right. I think another trigger to watch for, if you're just spending your whole day watching the news, you know, and taking in all of the stuff that's on the news, you know, might be time to turn off the TV or the radio, because, you know, home, here's the reality of what we're living with now. Home is work, home is school, home is family, home is everything. So before, we could go out. We could, you know, you could have some external release of stressors. Now everything is at home. And what you're finding is that if families weren't getting along prior to COVID-19, they may not have noticed, because work took place, friends took place, all of this. But now we're all under the same roof. And it's like, man, we're arguing all the time. Like, we really just don't get along. We don't know each other. We don't understand each other. The same thing with couples. They avoided the problem because they're like two ships passing in the night. And now the ship isn't passing. We're right here. And so the problems that we didn't want to address, the issues that we didn't want to deal with, they're present, they're up front, they're right here. And the last thing I'll say, and then I'll shift to Tammy, is this: the problems that we didn't deal with before the pandemic, right in front of our face right now to deal with. And they're compounded by the fact that we're restricted and we don't have an outlet.
And one thing we need to remember, and I'm going to just say this as nicely as I can: alcohol is not a medication.
Come on now.
Alcohol is not a medication. So a lot of times we are self-medicating with alcohol, marijuana. If we find that we have, but prior to the pandemic, we were having one glass of wine to relax, and now we're having 3, that's a problem. I don't care how you look at it, we cannot self-medicate with substances.
But it's not just substances, Tammy. Sometimes it's a matter of, I'm doing more than I need to just kind of calm down and relax. You know, I've got to spend more time exercising. I've got to drink more water. I'm doing more than I normally do just to try and calm down. You know, that's kind of something that's like, okay, wait a minute. I didn't do this much before. It wasn't this hard. You know, well, for men, sometimes men need to look at, hey, I'm wanting more sex than I did before because we're trying to calm down. We need to really look at, wait a minute. There's some things about me that I used to be at this rate and at this rhythm, and I'm not there now. I'm either moving faster or moving slower. And it's like, okay, I'm off, and I've got to find a way to kind of find my homeostasis, as they say, my place where I feel good.
Perfect. That's a great segue into like all the things that people are doing to say, okay, these are ways to sort of mitigate it in ways we're managing the stress that we're under, whether or not it's racial microaggressions, whether or not it's finances, whether or not it's relationships, whatever the situation is. So I want to switch, and I want to give Greg sort of a chance to maybe either chime in and close out that section or talk a little bit about self-care. So what are some simple, inexpensive techniques you should, anyone can do to improve their mental health? Like, what are some things they can do, since we know now that you realize that these are things that are not productive. What are some things that, this is sort of the free help section, I guess, if you will, of what can some people do to say, I can make a difference today to do this? Craig, can you kick that off, please?
Yes, ma'am. So a few inexpensive ways in which we can cope and not have to stretch the pocketbook out is journaling, doing virtual happy hours together. And it doesn't have to consist of drinking or smoking of anything. It could just be, the painting exercises or just different things that bring joy to your life. Calling on loved ones a little bit more that bring a natural smile to your face. My wife gave me a resource to start giving to the clients that I serve, and it's called COVID Coach. The U.S. Veteran of Affairs came up with a free application for the phones, whether Android or iPhone. And you can download this, and it actually walks with you as you're breathing. It helps you shut down for sleeping, and just you can set timers in it throughout your day, in which, let's say we're going to lunch break and we're going to take a walk on the Greenway or something, just to kind of change the scenery a little bit, because we've been closed inside a lot more here since the pandemic started. I've seen a study that showed that, simply the rate of depression since March has risen from 8.5% to 27.8%. And it's still growing significantly. So tapping into some of these free things, as I stated before, breathing techniques and mindfulness. So the list can go on, but definitely I found that COVID Coach has helped serve a lot of the clients when they're not in our presence in the office, that they can rely on that because they're always around the phones.
And if I can jump in and just say, just in terms of looking at our lives, in the Black community, religion, spiritual things are a big part of who we are. So I would say reach out, get on Zoom, watch a service, watch a lecture, watch a testimony, join a prayer group, arrange a prayer group with your friends, set up a Zoom for yourself to pray together, to discuss scripture, to talk about the goodness of a God who preserved us through some tough times before. This is not just our only tough time as people of color. We grew up on tough times, and we were able to get through those because of our faith and belief. So don't leave faith out of the journey to wellness and to mental health. And the next one is, get with your family. This might be a good time to teach kids how to cook, to teach them how to take care of themselves, to make fun out of lunch. We're gonna cut peanut butter in triangles, and we're gonna, do some different things to engage the family. Dance a little, put on music. You have no rhythm, but nobody can see you. So turn on dance as a family, engage with each other, take a walk, put on a mask and go take a walk. These are things that we can do to do some self-care of ourselves. And the last thing I'll say is be aware of your triggers, be aware of the things that are troubling to you, be aware of the fact that you're upset, be aware that you're irritable, and say that, I'm really irritable today, I'm not coping. Speak words instead of acting with family. Say to your family, listen, today is just not my day. I need to tap out a little bit. I'm overwhelmed, with life. And I can't meet your needs because I need to find a way to take care of my needs. We need to give words and expressions to our feelings as opposed to keeping them in.
And I'll just round that. Go ahead, Dr. Chester.
Okay. I just wanted to add a little bit to that. Hugs. Particularly working out of the pediatric clinic at Meharry, kids need hugs. We spending time with touch and affection, and these are things that naturally has the body relax and calm itself. So we can have hugs, we can have little arm wrestling exercises or things that would play tug of war with the towel. Things that you can do with your kids to have fun and enjoy.
And I will round that out with one of the things that Dr. Melville, Dr. M said earlier. One of the things she said is we need to turn off the TV. I think we're all interested in this politics game, but I'm telling you, I have not watched CNN or any of that in 2 weeks. And I tell you, my stress level really, really decreased because, you know, disconnect yourself from, have some social media free times. You know, social media is a great place to share information, but a lot of that stuff, you know, I don't want to hear how good people are doing when especially I know they're probably not doing as good as they say they're doing. The other thing is pick up the phone. I gave homework to one of my patients. I said, scroll down your phone and see who you haven't talked to in a long time and call them. Don't text, call them. It's something about hearing somebody's voice saying, I care about you, that provides so much healing. Go across the street to the older neighbor. You know that he lives there. You know he's been in the house. Just go say hi. Go check in on your people.
And we're
And I would
advocating
also,
that with a mask, right, Tammy? We're saying go there with a mask.
That's given. I don't think we have to talk about the mask thing.
yes. And I'll also like to add this. One thing that I found that's been very significant, especially in us Black males, is that when people ask us how we're doing, we get accustomed to saying, oh, I'm good, I'm fine, because that's the quick, that's the quick way to eliminate a long conversation, because it takes such a long time to really break down how we're really doing. And we might be there for some hours because we've been going through a lot of speed bumps in life. So I'm good when we're really not. And so having to learn that when you get home, like Miss Tammy Hines just said, and like Dr. Chester stated as well, making time to create those intimate moments by hugging or just really checking in, turning off from the news media and things like that. And so when someone asks you how you're doing, you can really be real with them and say, you know what, I'm not doing fine. Today has not been my day. You know, earlier in the week, I thought it was going to be a good one, but today, oh man, it's one of those days. So it's okay to say that. And it does a lot of just relieving you from stress, just saying that, you know, and being authentic. So I just want to say that.
But for people who are by themselves, a book to read, some puzzles to do, even if you're just coloring, I mean, those are some simple things that kind of help you with just your own personal self. Hey, if you're a female and you do your own nails, you know, or you decide, hey, you've never cooked before, but you're going to try a new recipe from online, or you're going to try and bake bread and you've never baked bread before. Listen, these are some times where you can explore some of the skills that you've never even tried before that you can actually do and enjoy. And if you feel too much alone, webcam somebody and do it with them.
Yes.
Amazing. Go ahead, Kia. I was going to say, jump in.
Yeah, I want to piggyback on the other side of the conversation, in particular, because I think that Dr. Chester and Gregory, you were mentioning this, and I think it's so important talking about when you come home, share your feelings. Tammy, you talked about this as well. I want to also provide some tools for people who are the receiver of that, right? Because we're all in this trauma together, and sometimes a person just needs you to hold space for them. They don't necessarily need you to then try to fix it or become the resolve. They just want to share. So can you give some advice to those people who are in caregiving positions, whether it's with a spouse, whether it's a parent to a child, whether it's a me to a older parent who won't sit at home? What are we supposed to do to make sure that we're just also holding space for them and not either re-traumatizing or creating more trauma in their need to share? Greg, I saw that you unmuted. Would you like to share?
Yes, ma'am. One thing that I would say that I've learned by being involved in marriage builders throughout, pretty much throughout the pandemic, that's been a very supportive thing that the church has been providing with Ms. Cox, is it's okay to ask the question, once somebody vents to you, do you mind, or would you like for me to give you my side of the thing? Or how would you like for me to be of help to you? It's okay to truly ask, because when you love somebody, you think that you have the tools in the toolbox to go ahead and fix it, because we've known each other for so long. But sometimes we can be, like we can't step on certain triggers that have been, created or newly identified. So being okay with just asking, how can I help you? Or do you mind if I say something after you finish talking? Or do you just want me to listen? So ask for permission. I would say that's a big one.
Yeah. I want to piggyback on what you said, Greg, and say, yeah, just ask the person, what is it that you need from me in this moment? What do you need? because sometimes a person just wants you to listen. Sometimes all they need is space to vent, you know, or even if you have a loved one at home and you go out of the home and you come, it might be a good time to ask the conversation, how are you feeling being here with me, leaving and coming? You know what I'm saying? Like, you know, I'm out in the community, you know, how are you internalizing that? Are you scared that something's going to happen? Are you worried about my safety? Are you worried that I'm going to bring something here? Tell me how you're feeling. What are you doing during the day when you're here all day and I'm at work and you're left with everything? You know, it's just having that conversation. But the other side of that too is recognizing that when somebody walks out the door, but when somebody comes in the door after they've been gone all day, they might need a little headspace. It may not be a good time to engage in conversation. They may need 15, 20 good minutes just to de-stress before I start talking about my boredom, before I start talking about all the challenges that I've had during the day. They may just need to be for a minute without anything. And I think some of those values are important when you have one parent or you have one partner or an individual that goes and comes, is recognizing what each other needs in that moment and asking the question, when you come in the evening, what is it that you need most? Or when I come in, what is it that you need from me? It is an opportunity for us now to have conversation, transformative conversation that we never had prior to the pandemic because we didn't feel like we had to. You know what I'm saying? There you go.
And Kia, one of the things that I would like to add, I don't remember saying it, but a part of self-care is when you're working from home, taking a break, taking lunch away from that desk. If possible, make a work office so you can shut that door. You know, I know a lot of us have small spaces and our work space is in the living room. If possible at all, make some boundaries to where that is. Because we know that statistics show that when we work from home, we work a lot more because we want people to think we working.
Absolutely. Go ahead.
Tammy, I would say, add to that, and there's a great point you just made. Get up and get dressed as if you're going to the office. Get up, shower, get dressed, put on a little makeup. If you used to wear a tie in the office, put one on. Don't put on a top and be in your pajama bottoms. Do you see what I'm saying? Prepare for the day as if you were leaving home, because that's also a change in your perception. You've now gone into work mode. You know what I'm saying? You're dressing for success. You're ready for the day. And
Stop calling me out, Dr. Chester. Stop calling me out. I'm just gonna tell you.
You know, we have to get into that headspace of this is work. And when you're finished with work, go and change into home clothes. Make the mental transition. I'm not at work anymore. I am at home. And that's also something that we need to, when we're working from home, is to be cognizant of that. Now home is work, work is home, but I need to make the transition from a mental health perspective so I get out of that frame of mind.
And the reason why this conversation really is important, because some may ask, what does it have to do with philanthropy? What this really has to do is it is our mindset, and then making a mindset change, a behavior change, and then doing some level of action with that. And that's the same thing you do. What are you all seeing relative to finances, right? I think I talk a lot about relationship with money, and sometimes in our community having some challenging relationships with money. And in particular, now we're either very stressed with money, or some people are in influx of money. It is happening on both ends of the spectrum. What are you seeing relative to those behavior changes or those mindset changes? And then what are some tools or tips to keep people thinking that we still have to give and serve other people, that is still calling to people? Tammy, go ahead.
So what we find is people, and this is not even due to the pandemic, people are uninsured or underinsured. And if I have insurance, if my deductible is $9,000, which is a deductible for a lot of them.
Mm-hmm.
When you go to the doctor, generally you might have to go once every 3 months or once every 6 months. So your copay is not an issue. But when you go see a psychotherapist or a mental health professional, I like to see my people once a week for the first 4 weeks. So if I have a $35 copay, that's going to be $140, right? Also, if you haven't met your deductible, you know, my biller will say, oh, her first payment is $96.32 and each additional payment is $86. What? So that is where philanthropy comes in. And it's making sure I run an agency. We don't turn people away because of inability to pay. I work on a sliding fee scale. I try to, if you can pay $5, that's what you pay, but I can't live my life on it all the time. So that's the part where other people, and I've had people say, hey, I want to just donate, you know, a copay. That's generally between $35 and $40. I want to donate, you know, for somebody to not have to pay this high deductible, you know, and most of them are healthy Americans. So if you're healthy and have not had any medical treatments, you can't even reach that $5,000 deductible.
Mm-hmm. Mm-hmm. Mm-hmm.
And what I'm hearing you say is that there's an opportunity for people who are business owners, a person who, if they are in partnership with you, but they're not in the home with you, for them to say, I'm going to make this contribution to someone else, because
Absolutely.
it's make sure I ensure that my community is well. I think that's a really strong point.
Yeah.
And
I think to add to that, treatment is also not cheap. I mean, if you have someone with some type of mental health issue and they need medication, oh my, because your insurance might not pay for the mental health treatment, but it will pick and choose what medication you can get as well. And that may not necessarily be the medication that works for you. So there are some interventions that are out there that could be very beneficial to you that you won't have access to. A good example of that is neurofeedback. It's a very good program, works very well. However, because insurances don't pay for it, how many of our people are going to actually access or have access to it? So there's some other areas as far as treatment with our children, as well. How do we help them with the treatment? How do we help them with the interventions? How do we help them with the medications that they can't afford?
You know, I just want to add to that. I was reading a recent report by SAMHSA that just came out here in 2020, and one of the statistics says only 6.5% of Blacks that need medication actually get medication and actually on medication. Because one, you know, we talk about copay for treatment, but then there's also for medication. And so some people have to pay $25, $100, whatever, for 30-day supply of medication. That's making a choice between food on the table and the medication that I need for my mental health. That's making a choice between paying my rent. That's making a choice between paying for the lights, buying food. And this is huge in our community. Those of us who serve the community, Tammy, I agree with you. When somebody comes to you for your first session and you can tell that they're in crisis, and Gregory, I know you can relate, and they need the services, and then they say, you ask the question, we accept insurance, okay? And so you ask the question, do you have insurance? They say no. And then you say, okay, so they say, and I can't afford to pay. As a provider that's doing services for mental health, I'm hard pressed to say, no, take your depression and go home. And I hope you find a way to deal with that. I now feel some responsibility that if your depression gets out of control and you commit suicide, like, I could have done something to help. So I am hard pressed to tell you no. You know, so you said you spend 45 minutes and you collect $5 and you're like, well, but that's all they can afford. But at least I can sleep. You know what I'm saying? Because I know you're safe. You see what I'm saying? And that's the thing. So as a provider of color, we have to grapple with, because I feel, and you guys tell me if you feel the same way, if we say no to our community, they may never get the service they need. Like if we turn them down, and to Tammy's point, but we still have obligations of our own that we have to meet. But the one thing I know that my faith lets me know is that everybody that I serve, God, for free, God is going to send me somebody who can pay. I firmly believe that. And because of that, I don't say no. I just say, well, I guess I'll see you next week. And I said, Lord, this one is on you. And, and I leave it there because we have to give back to our community with a recognition that they may not have it to give to us. And that's where philanthropy comes in. Philanthropy can ensure that Tree of Life counseling and consulting services have some money. So when individuals contact me and they can't pay, I can say, that's okay. You can get your first 6 sessions. Come on, without a problem. Philanthropy can help us with that because we have a service to provide and we have a community that needs that service.
Perfect. That's
Yes.
exactly what I think Kia was kind of going with from the standpoint of how does, because we have philanthropists who are part of the community foundation and who are listed throughout the world who may want to support an organization, or are you guys aware of any funds or specific areas that people can funnel that? Because there's a logistical issue, right, as well, because when you bring those funds in, they have to be accounted for through an accounting process, and that creates challenges as well. So putting them through a foundation or some type of nonprofit that's already set up makes it easy for you to receive the funds instead of receiving $15, $20 that now you have to account for at the end of the year and figure out how to do that. You can receive a lump sum. So are you guys familiar with any funds or any places that people who are now listening and saying, hey, I didn't realize this was a problem. I didn't realize that, you guys are charged with that, hoping that somebody can pay when they need services, and respecting and honoring the work that you've put in and the education to be able to make sure you pay for your services. What are some ways that what are some funds or things that people can give to make sure those funds get to you?
So unfortunately, we don't know a lot of programs like that. Because let's just be real, mental health has not been something that we focus on. But I will tell you, there are ways. I wanted to mention this before we got out. Most people don't know that if you have a job, your job, part of the benefits package is EAP, Employee Assistance Program, right? And your job usually will provide you 3 to 12 free sessions. So that's, great. When I was licensed, I received loan repayment from HRSA.gov. They repaid $50,000 of my student loans. So that accepting these people on a sliding fee scale helps me. But a lot of times we don't have any way to filter those funds because a lot of us are not nonprofit. A lot of the community health centers are nonprofit. But let me just tell you this. Everybody does not want or need to go to a community health center for services. I should be able to have a choice just like everybody else in my care. And community mental health services some of the sickest of the sick, severely, persistently mentally ill people. And sometimes just walking in the lobby and looking around and I'm like, wait a minute. I'm in the wrong place. Mm-hmm. And that in itself can deter a lot of people from seeking those services. I have reached out to Governor Bill Lee several times to have him include private practitioners in anything that he does. But it just seems like we get shut down because the money is going to go to a community mental health center and not to the backbone of this industry, private practitioners.
Mm-hmm. And Tammy,
so it sounds like we need a fund.
Yeah. So let me say, and I'm sure Tammy and Greg will agree with this. Most, private practitioners are very diligent about income that comes in because we have to pay our independent taxes.
We sure do.
I have an accountant. And so, you see your bad debt. You see people who cannot pay. It's sitting there. So there's not a problem accounting for the number of people that I see for free service because it's there. It's on my platform, cost $140, collect zero. You know, write off 140, client owes zero. You see what I'm saying? It's there. So it's not an issue of accountability, you know, for us. The fact is we can produce the evidence. No, we're not going to give you the person's name because HIPAA, you know, we're not going to come get our license here by divulging people's name, but tracking of where dollars go to provide services is not a problem that we would have. I agree with Tammy. Individuals should have the right to access services regardless of their ability to pay. Just like from a medical perspective, you can go choose your doctor, you know what I'm saying? And so you should be able to, I encourage clients that call Tree of Life to interview us like you're interviewing for a job to ensure that we're a right fit for you. And if you decide we're not a right fit, then go interview somebody else and see if they're a better fit. Because at the end of the day, what happens to you matters to us. And we want you to get the quality care that you need in a safe, comfortable, confidential environment that's going to help to advance your mental health and wellness.
And we do not mind referring you out for cases that are not in our purview. Or if this week I took on, 3 people who were not able to pay, we have a network of people that we go through to say, hey, can you take, this person? The other thing that I strategically did in my practice is I made sure I accepted Medicaid. I wanted to have a diverse group of clients. And it's not easy always taking Medicaid, but I don't want to be the one who is a cash only provider because that's going to limit the people who I find it necessary, especially in my community that I live in that need help.
Yeah, the difficulty, go ahead, dear.
I'm in a slightly different position than a lot of the others who are looking at private practice. Being here at Meharry Medical Clinic, Pediatric Clinic, there are lots of children, families that need services. We provide services. They can't afford some things. But in that process, in us trying to provide the services, we too have needs. Okay? The idea, hey, we need toys for kids to play with. Kind of some simple things. Or, hey, we've got to pay attention to COVID. We need extra masks for little kids that are coming in. There are some other avenues, but as we're trying to provide services and we also need assistance from everyone else. It's like, hey, they're doing this over at Meharry. What do you mean? Well, we're trying to take the initiative of making sure that every kid is able to get some mental health services, especially in our community. And that they get some mental health checks up at least annually. So we're trying to do these things, and we would encourage everyone else to try and get on board and kind of utilize our strengths. Because we can't serve everyone. But if everyone serves somebody gets something served.
And the unique thing about working with children, when you work with children, guess who else you're going to be working with?
Family.
With the family.
So that automatically turns into family, right? And a lot of times the child might have insurance, but the parent may not. But I don't treat children. I can't treat children without involving the parent.
Right.
Tammy, go back to what you said about Medicare and Medicaid. The rules have changed so much that just trying to get to be a provider it's become very, very difficult. And the process is so difficult that you're like, you know what? this is just way too much headache here. You know, you have a 55-page application, you fill it out, you turn it in, and then you have a 75-page questionnaire trying to answer, just to be able to serve your community. So for me, I find that it's just easier to offer some free service than to take myself through that, because it is difficult. And so what I do is I will refer to a family. If they have a child that needs service, I'll refer them to Meharry, to the pediatric clinic. And if I know one of my colleagues that does Medicare, I'll pick up the phone and say, you know what, I don't accept it, but let me give you 3 referrals. Call and see who is accepting patients. And I think we have to just get to that place, like you said, Tammy, where we know our strengths, we know what we can do, and we include each other, because it's going to be all of us working together that's going to make a difference in this community. It's not a all for me, none for you. It's all of us coming together like we're doing in this conversation and letting iron sharpen iron and build our strengths so that we can take care of the community.
Perfect. So I think there's a really great opportunity here to sort of make sure we highlight the practices that you guys are affiliated with. So if someone is listening and they want to either get services or they're interested in supporting your services and the things that you do, because you guys are highlighting some really great things, I want to make sure they have that. So we have Dr. Robin and Dr. Anidolee Melville-Chester at the Tree of Life counseling. Also, it sounds like Dr. Chester, Robin Chester is at Meharry as well, the Elam Mental Health Center. Dr. Hines, go ahead.
I'm at the Meharry Pediatric Clinic.
Okay, Meharry, thank you for correcting me on that.
Yes.
And then Dr. Tammy is at Bellevue Behavioral Health. And then Mr. Holley he's the owner of Transformative Medical Health and Wellness, as well as a consultant at Bellevue Behavioral Health. Kelly is in the behind the scenes from the Community Foundation, is going to put contact information either in the link as well. So if you have questions about either coming to see any of these great providers and or contributing to them, and we encourage you to do both. Also through the blackgivingback.com, that is a fund that is at the Community Foundation that will receive funds that we are looking at mental health as being one of the areas that we address in 2021, when we'll talk about a little bit more about some of the things that are coming in 2021 for the blackgivingback.com. So those are places where those funds will come to. One of the reasons that we do this specifically is because we know that sometimes funds don't end up where they need to be when they're given to a big foundation. And so the blackgivingback.com fund or website will basically be an opportunity for us to work with these organizations and other organizations in the area that will make sure that they get the funds they need to pay for co-pays. They can, do some additional training with them or resources with people so that they have those accesses. So if this is something that you either need for yourself, please reach out to one of these providers and or also reach out to us via blackgivingback.com and receive funds. We can receive funds in that we can make sure get to them for mental health specifically. Before we sort of close out, I want to kind of go with next action steps, right? So what are some things that philanthropists, I know we've talked about a couple of I want to get everybody sort of one or two things you think a philanthropist right now who's listening can do right now to sort of help you guys, manage or whatever, other than the two things I already given to the blackgivingback.com. Anything else that you think philanthropy, the community should understand so that they can continue to contribute? Gregory, I'm going to start with you.
Yes, ma'am. So pretty much when I was kind of going through, just bear with me one second. I was typing in my information on the chat. But I would like to add that just some things that I would like for people to know about philanthropy within the Black community is that, looking at some data that I had found, it stated that as of 2019, pretty much 13.4% people in the entire United States population identifies as Black or African American. And then 16% of those people reported as having mental illness within this past year. And that's over 7 million people and more than populations of Chicago, Houston, and Philadelphia combined. And so when I look at that 16% number reporting having mental illness, as Tammy mentioned earlier in the segment, and also Dr. Ann, churches, getting involved with our churches, because one thing I can say about being here from Tennessee and my family being in New York is that when people show that they have, or they highlight having a significant mental health issue, family members will make comments and say, you know, hey, you just need to pray about it, or you have a demon in you, or things of such like that. So people withdraw socially, and then they feel like they are a problem, or they do have a problem. So churches, having them, you know, more heavily involved with carrying out the message and things like that. And, you know, just kind of, you know, I guess I'm twisting up my words here. I've been drinking a lot of coffee, but just, you know, just pretty much, you know, consulting with different people throughout our communities, but getting them involved. One thing I can say that I have done is that my college coaches from Tennessee State University in Southern Illinois, they have been very generous to me throughout this year of the pandemic by involving and helping to make donations whereas as needed. So not only is it a help of serving college students and athletes, but just kind of help to serve the civilian population of Nashville, Tennessee, as well as West Tennessee as well. So churches, consulting. So.
Perfect. Thank you. Dr. Robin-Chester, please. Do you have any closing remarks or things that you want philanthropists to know about why they should give to mental health issues?
With mental health issues, it's a little bit different than our medical issues. Medically, if we break an arm, as Tammy said earlier, we gotta know we have an arm that's broken. But mental health, sometimes we don't see it. We don't know it. But yet still, the effects of it actually reaches everyone around us. It reaches our family, it reaches our neighbors, it reaches our schools, it reaches our doctor's offices, it reaches our entire community, and our entire community begins to suffer from it. So when you're talking about, hey, philanthropy, wait a minute, let's look at how can we possibly give to certain research projects? How can we give to look at how can we provide services better? There are some areas that we can actually utilize funds so that we know what works best for us. So get involved in some of the research. You know, hey, we have kids that have these issues. What can we do to help with that? What does the research say about it? Well, the issue with the pandemic, we have kids that are going in and out of school and they're getting frustrated with it and they're hating it. How can we better do that? What is some of the research saying about that? What is it saying about the parents who don't have the equipment to actually help, or who does not have the wherewithal to do the new math to help our child and try to teach them the things? What are some things that we can do? These are some things that we can do as far as philanthropists.
Thank you so much. Dr. Anidolee?
So I will add to what my colleagues have said so far, and that is one of the things that philanthropy can do is help us to normalize the fact that mental health as economic, social, cultural, spiritual, and familial impact on the community. Those impacts are present. If you have a person that has a serious mental health illness or they're suffering from a trauma, there's economic impact. They may not be able to go to work. They may not be able to hold a job. And so it now means that this is someone that the community might have to take care of. So investing in individuals' mental health means that we're helping them with the ability to care for themselves and to become self-sufficient. The fact that we're in a time where things have changed. And so how we look at mental health needs to change. How we fund mental health needs to change. That this is not just someone could have a mental health issues. The reality is that what this pandemic, first of all, the tornado and then the pandemic colliding on each other, what they've done is left people in a hopeless place, left people feeling as if they cannot stand, they can't get it right, they cannot take charge of their life, feeling powerless. And one of what individuals need is to be able to take back their power and have a voice and be able to take charge of their life. And we're in a place where people don't feel like they're in charge of their life. Let me just say one thing about schools. We focus on the fact that we're doing school by Zoom, but I'm wondering how much we're focusing on this being traumatic for the teachers and the educators that has to provide this education in a different environment, where they may have had 4 weeks to learn a different environment to teach students, because this is not something they ever had to worry about. Kids were coming into the classroom and they were able to teach. Now, they have to find a creative way to engage students. Those teachers need support. They need an outlet. They need a forum. They need to talk about their own stress and the impact of this pandemic on them as a teacher. And I would even say providers, like those of us that are here, we need self-care, because we're dealing, I don't know about Tammy and Gregory, but when you listen to 9 clients in a day that's depressed and anxious, you need a walk. Like, Lord, you and I just need a walk and talk so that I can process through some of that. And so that self-care for us is also important. So opportunities for philanthropists to create an endowment or a fund where clinician can go and either get training, do CEUs, or do some self-care, those are also some opportunities. And we're in a time when all of us need to take care of ourselves before we can take care of someone else.
Amen. Dr. Tammy, I'm going to let you close out the segment with the final word from the panel. And then Kia, I'm going to ask you to jump in and make sure we got everything covered. Dr. Tammy?
Let's have a serious conversation, which we've done this last hour. It is well known that the pandemic and just life is causing the rates of depression, the rates of stress, substance abuse, anxiety, and other psychological problems to sharply increase. And keeping it real, the rate of fundraising and giving to just these charities are not keeping up with the pace of the need. This is serious, and it shouldn't have to hit home for you to become involved. I mean, I would be willing to, I'm an advocate, I'm gonna tell you this, I fight every day. Like I said, I done left 10 messages for the governor, Bill Lee. But this is one area that's not going away. People need to be supported mental health wise. We will go across a hospital and see all these great, names on the walls, and this person supported this. And it's almost like mental health is shoved into that healthcare world, but we're not getting any of the funding. So donate today.
I agree.
Kia?
Yes, this was such an insightful conversation. I think there's so much more to talk about relative to this conversation. What I really appreciate that has come out of this is a couple of things. One is thinking about how we can be better advocates for our young people in the community. And so I encourage you all to figure out how to support the Meharry Pediatric Center there where Dr. Chester is, because I believe that's where we know we can make an investment in a lot of places, but that's a really great place to make an investment, because we know it's a whole person care, even if it's technically just for young people. And so figuring out also how to support young people is, I think, one of our greatest responsibilities as a community. So that's one thing. The other thing that I'll do is I'll challenge, as I do in a lot of these calls, our faith institutions, because that's where a lot of people are spending their time, really to ensure that we're not just thinking about the spiritual care, but also the physical health and mental health care as well of our congregants, those who sit now virtually and some who sit in our pews, it's really our responsibility to make some additional, this is what modern day civil rights has to look like, is really to think about the mental health care. So I'm encouraging that. I encourage you to go to blackgivingback.com to support the Give Black Give Back initiative, or the many funds we have, the many nonprofits that we support, because we cannot reconcile, we cannot reconstruct, we cannot restore our community until we restore ourselves. And so it's our responsibility to figure that part out. I'm so grateful for our guests, of course, my co-host and co-chair, Lisa Swift-Young, of this initiative. Thank you, Tammy Hines, for being here, Dr. Rob Chester for being here, Gregory Holley for being here, and Dr. Anidolee, Melville-Chester. I'm so grateful for your time. On the behind the scenes, we have Kelly Wahlberg, who is ever so gracious to make sure she's our Zoom chair, our hot seat collaborator. She makes sure we get it all done, as well as Audra Cox is our amazing liaison. We're so grateful to the Community Foundation for giving us the platform to have real honest conversations about Black initiatives, in particular Black philanthropy initiatives. And until we see you again, have a really happy holiday and go to the website, blackgivingback.com. Thank you all. Bye.